Good afternoon. I want to welcome you all today and thank you for joining us. My name is Mary Ballacher and I am the co-chair of the Forum's Kidney Patient Advisory Council. And today I want to get started because we have some fabulous folks that are going to actually speak, and I think hopefully you'll learn some new things maybe, and also just kind of how patients and kind of what we do to keep ourselves safe. So with that, I think we'll get started. Our presenters today, to start with, we're going to have our forum president, Dr. Landry, and then after that we will have a couple of kidney patients, Johnny Jones, Timmy Nelson, and Stephanie Dixon. So our first speaker is going to be Dr. Landry, and I also wanted just to make sure that if you have questions, please put them in the chat. Kelly, our very own Kelly, is going to follow up with the chats, and then at the end, we'll be able to have an opportunity for you to ask questions. So with that, I would like to turn it over. If you're ready, then Dr. Landry.
Thank you, Mary. It's really an honor to be here tonight, and I really appreciate you and, of course, the leadership that you and Don Edwards provide to the Kidney Patient Advisory Council, and all the support that everybody here gives to the forum. So, and our patients, of course. So, anyways, it's great to be here tonight, and I hope we can provide everybody here with a nice, informative discussion. And as we kind of go through some of these slides, we'll have an opportunity to, like I said, share some questions and comments later. Um, I'm Dan Landry. I'm the president of the National Forum of ESRD Networks, and I'm also a kidney doctor who works out in Springfield, Massachusetts. So next slide, please, Kelly. And just as an introduction right now, we're going to talk about tonight obviously the challenges that our dialysis patients face in terms of not only bacterial infections and the challenges of different forms of access for their dialysis, but also the fact that we realize that bloodborne pathogens are fairly easily to transmit. It's a major risk, and that not only dealing with what we're taking care of today, but also what's around the corner and the different challenges we've faced. I think most, if not everybody here, has also lived through the COVID-19 pandemic and the challenges we had there as well. So there's a lot of different things we have to think about every single day to really make sure that we provide the best care for ourselves if we're dialysis or transplant patients, as well as from a provider perspective. Next slide there, Kelly. And here, really, at the end of the day, is kind of this call to action, I like to say, and others have said as well, where we need to make sure that we are improving infection control in our dialysis units, as well as at home for those doing home therapy. Different coalitions like the Nephrologist Transforming Dialysis Safety have done an incredible amount of work over the years in terms of trying to help teach staff, support patients in terms of trying to reach these goals. But ultimately, it really comes down to each and every one of us to really kind of take on that charge. And I think anything that we can do to help empower our patients to speak up for themselves, to ask questions, to say when things don't seem right is really critical. Next slide, please. Here's something that I actually heard people talking about a little before the conference started tonight, but staph infections, staphylococcal infections, they go by different names, but the most common bacteria that we see occurring in our dialysis patients beyond comparison to anything else they're 100 times more likely to occur for people who are on dialysis versus those adults that are not on dialysis. And next slide, please. And if we also take a look at, the backgrounds of our patients and the people we take care of every day, by increasing levels of poverty, household crowding, educational backgrounds, those are all associated with increasing risk for developing infections on dialysis. And that's why it really behooves us as not only people who take care of patients on dialysis and the next generation of providers who are going to be doing this, but for everybody here tonight to recognize the fact that we need to provide more education. And it's not, as I think everyone here knows, not a one-time event or a two-time event. It's something that has to be a continuous process we have to keep working with. Next slide, please. And while at the end of the day, I always want to make sure people here tonight and everywhere know that you need that we all need to make sure that we provide the education and the ability to make informed decisions about what's the best access for us, for those people who are on dialysis. There is, regardless, still strong clinical data that would indicate that in terms of the risk for infection, fistulas tend to have the lowest rate when it comes to people on hemodialysis versus grafts versus central venous catheters, which tend to be about 6 times higher. Now, with that said, there certainly are caveats to that, right? And I think for people who either work with providers who are very savvy and comfortable with using catheters, or patients who take care of their own catheters, oftentimes there are things that be done to help reduce these risks, but nevertheless, it does come with a higher risk of infection. Peritoneal dialysis patients and their catheters tend to be thankfully very low risk. And another reason why it's a wonderful modality for people on dialysis, but just some important things to share. Next slide, please. And here is just a kind of a commentary, as I mentioned just a moment ago, in terms of some studies done about the risk of infection. And here, if you look at this, the relative risk, this adjusted relative risk, or ARR, about 6 times higher risk for central venous catheters compared to fistula, grafts about twice as high. Next slide, please. In terms of the routes of transmission, I think we all recognize the fact that some of the most common things that we face are, physical contact, right? Bloodborne transmission is always something else we also are concerned about. And the reason why we utilize the types of infection control techniques that we do, either at home or in the dialysis clinic. And of course, there are also times when droplets can be the spread of different, particularly types of viral infections most commonly. Next slide, Kelly. And when it comes to how or with whom we transmit these infections, they of course can occur from a staff member taking care of a patient, but also from patient to patient. And that's why we have to take these risks so seriously and always have a constant level of vigilance to kind of maintain that that awareness, because these risks can come from contaminated devices, the chairs that we sit in, right? Different forms of equipment or supplies, as well as the hands of personnel. And next slide, please. And here's just kind of a cartoon or a picture of all the different potential options or places where infections can come from. Next slide, Kelly. As well as different efforts that have occurred over time to help reduce the risk. And in fact, the CDC and that national, Nephrologist Transforming Dialysis Safety Coalition created years ago this hand hygiene audit tool that is now utilized throughout the country and has been for many years, and has been shown to reduce the risk of infection when you follow it closely. So these are the types of things that we not only are teaching our staff members in dialysis clinics and auditing to make sure that they're continuing to follow these rules and guidelines, but also the same types of things that we're showing you, our patients, when you're involved in your care. And of course, I think it's also critically important to remember too that not only patients who are on home dialysis need to be empowered to take care of their infection control care, but certainly people who are in center as well. And whether it could be different levels of your own personal intervention or involvement in your care, as well as kind of pointing out concerns or things to staff members who are involved taking care of you. Next slide, please. I just wanted to show the group here an interesting study that was done some time ago, and maybe many of you here have actually seen this or been involved in this as well. But there's something called GlowGerm, or something that can be used and applied to people's hands to show it lights up when there's actual bacteria on your hands. And this has been shown as a way of indicating how good a job people are doing with hand washing. Next slide, please. And in fact, when these types of interventions through the audit tools, as well as kind of exhibits to kind of tell people to show them, to say, we really need to do better to really make sure that we're keeping our hands clean, staff members as well as patients alike. What this study shows us is that with these interventions, there was a significant reduction in the risk of bacteria on the hands and the risk for transferring infection. Next slide, please. Another thing that, of course, is 2025, right? I mean, everybody out there has an electronic device, Android, iPhone, you name it, a cell phone of some form, iPads, different things. We've looked at this and we've identified the fact that these, of course, are sources for infection control too, right? These are surfaces. These are things that people can transmit bacterial infection with, and to that end, it really is, incumbent upon all of us to point out to our providers or staff members, if they're using their devices within that window of space where we're, receiving treatment, that we say, I really need to ask you, please, to make sure you wash your hands before you either touch me or the machine after you've handled your electronic device. And people really shouldn't be using those devices within the area of your treatment. Next slide, please. And that's where, many entities, but particularly efforts through the federal government and the CDC and people like the American Society of Nephrology, as well as a forum of ESRD networks, where we've all been involved over time to try to help, say, how do we put this puzzle together? How do we work together to kind of make sure that we do the best for our patients to help reduce the risk of infection? And that has to do with, in the right circumstances, trying to reduce catheter use, if that's the right thing for the patient. The hand hygiene piece, of course, we can talk about again and again, making sure that the dialysis station is disinfected appropriately, patients receive adequate vaccines and ways of preventing infection, as well as staff members, taking care of the catheter care and cleaning the hub, and making sure that, again, patients are involved in this whole process and that you're not someone who's just kind of passively receiving care. Next slide, please. And that's where, along the way, we received a lot of different recommendations in terms of how to best reduce bloodstream infections in dialysis facilities. And again, this goes along with other places as well. And this is something that, can be applied. I want to make sure everyone knows, not only to patients on hemodialysis, but peritoneal dialysis patients as well, and making sure that everybody here is involved. Next slide, please. And the CDC, of course, reminds us that there's different tips for helping reduce infection if you do happen to have a catheter. And I do want to say to everybody again that, catheter infection risk is something that can be applied through peritoneal or hemodialysis. Next slide, please. And likewise, again, with fistulas or grafts, efforts to kind of to help reduce infection. And some of those things, of course, too, include, not to forget, washing the access site before someone does, cannulate. Next slide, please. And that's where I think that, this is, I think, a nice cartoon, but also I think just kind of informative from the perspective of how do we engage our patients? How do our patients engage us? How do we make sure that you're not afraid to ask the questions that you need to ask, that you're not afraid to actually take charge of your own personal health care, allow us to be your partners in all this, and make sure that we're doing the best by you. And that's where we're working hard to make sure that, like I said, the next generation of providers out there are aware of this as well, and that as well as the patients and the loved ones who work with you and work with us every day are well informed. Next slide, please. And I think to that end, I think that's where I think the most important takeaway from this evening, from my perspective, is just trying to encourage everybody to be open, willing to have a conversation, to receive information, to take critique, and to be willing to kind of work with each other. Because I think at the end of the day, we really have some wonderful tools out there which have shown excellent results in terms of reducing infections for anybody with any type of dialysis access, any dialysis modality. But we need to make sure that we settle for nothing less than the highest standards of care. Next slide, please. So in conclusion, I think that, it's the dialysis units and as well as care at home, it's a culture that we need to embrace, a culture of the highest standards of infection control, prevention bundles, things that have been done have really great support behind them and research data to say that they really truly work. But we got to make sure we put these to use. And we know every day, right? The people here tonight, many of our patients on dialysis or with kidney transplants have lived this well and can speak to this better than even I can in terms of recognizing the fact that we have new staff members involved in our units every day. We do have turnover. There's some of the challenges that we face in dialysis clinics like we do any place else in this country of ours. But it doesn't mean that we have to lower our level of expectation, and we need to demand that of each other. And that's where we can, engage in that. There's lots of great resources from the forum, from the American Society of Nephrology, from the CDC, and we have to be prepared for whatever is going to come around the corner. It could be some sort of infection that you hear about online or on TV, or much like, still kind of trying to learn from what we've experienced through COVID-19 pandemic. But at the end of the day, we can absolutely do this. We just got to really work with each other. So thank you everyone for your time tonight. I think that's the last slide I have. And again, after we have an opportunity for our other members of the team to talk, happy to answer questions.
Thank you so much, Dr. Landry. That was great information that you shared. I'm sure we've all learned a variety of things by that and just the risk for infection. So with that, with further ado, I would like to just remind people if you have questions to put them in the chat. And next up, I will have Johnny Jones, and he'll kind of talk a little bit about his experience.
Hey, thank you, Mary. First of all, I want to thank you and Dr. Landry for especially for the slide and for the opportunity also to be a presenter. My name is Johnny L. Jones, and I joined the forum. I think this is my second year, and talking about infections, and which is one of the things that a big fear of dialysis patients. But when I went on dialysis, it was 2010, and a lot of resources. Really, I would either I wasn't paying attention. It just the fear of just going on dialysis put me in a place where I wasn't looking at the facts and trying to find out the resources that was out there, and then and the risk that I was in, other than that, just being sick. And if you ever been sick, getting an infection is just a tab above being sick, because you at that point where you got high fever, you delirious. The gamut is there. But for me, when I got my the infection, I think it was like my second year, and I was prone for the infection because staph infection is the number one. Like Dr. Landry was saying, you 100% chances of getting a staph infection because you got an open wound. And we all always talk about germs, but think about it. Bacteria, germs, scientists have proven that we got no million germs that are out there. So that means that each individual 9 billion of us, million of us on this earth, we got about 1 million germs waiting around that's sitting on the surface or whatever. And that is, we always think about the number, 1 trillion, but no million, that almost 30 zeros added. So that means germs on everything that we touch, we come in contact with, and our exposure. And then for a dialysis patient, it even greater, because you walk in, you have an open wound that you get cannulated every 3 days, so we walking around with an open wound waiting for staph infection to happen. And that's what happened to me. I got the staph infection after 2 years on dialysis, and it put me in the hospital. And what they do is all germs and bacteria, whatever, so many different ones, they had to come up with a concoction to kill off that, because they mutate, whatever. like the virus or fungus that we get from different germs. So they had to come up with a concoction to kill the bacteria off. And I was in hospital for a week and going through recovery. So it takes time. And one thing about a dialysis patient, you have to pay attention to your access site and look for the signs. The signs you might have swelling, that buzzing sign you get from your site. It might not be there, it might be faint, where sometime before it was just a loud buzz. It might be warmth. And I think mine, when I went into it, I was using like I think it was they call it the LMX4, which Lanacin. I think that's what they put, like when you numb your tooth when you get ready to get the tooth extraction, or either your tooth clean or whatever, if you got sensitive gum. So I used to use that. So what I did was I knew about the hand washing and all that stuff, but the cleaning the site, I missed that step. And I see Dr. Landry have that in one of his slides where that is step 3. So I missed that step. And what I would do was wash my hands, and with the cream, because you have to put the cream on 30 minutes prior. So I would put the Lanacin on and go sit in the chair, and then the tech would wipe it off, and of course he cannulate. And what was happening was, when I was getting cannulated, I was getting the infection through because the site wasn't being cleaned well, because the technician would just wipe it off, put alcohol on it, and boom, I get cannulated. And it was just a matter of time. And then I got infected that way from that. And that infection put me in the hospital. And in terms of just by being on dialysis, we are a high candidate for infection anyway. Because when CDC started going with trend in terms of infection, yearly, almost 120,000 people was getting infection. And out of that 120,000, about 20,000, close to 20,000, was dying from it. So what was going on? That means that we weren't paying attention to the germs around us, because there's so many of them. And like me, I went out after I went through the infection and went through all the process to get my health back. I went and bought a UV light, and I was like checking everything and seeing like everything that the bathroom and your kitchen is mostly where you're gonna see your germs and bacteria at. And I was a high candidate. I use Clorox and everything. My wife, she hates it, but I was Clorox guy. I have Clorox stuff down after the UV light. So just being confident of all the thing, the prevention and safe prevention for the how you can prevent the getting staph infection, because staph infection mostly is waiting for a dialysis patient, but for transplant patient, we got you goes into sepsis, which goes into has to enter your body, because bacteria basically it can hang around in any environment, but once it entered the host, that's when it started doing other things. But sepsis more or less affect the transplant patient, because it goes into your lower like UTIs or whatever, then it goes up to your kidneys. So once that get in, and then when you get to your kidney disease, I think the other is the prolo or arthritis, whatever they call it, kidney disease. That's when you really get sick, and that's when it goes into like the transplant patient, more or less than the dialysis patient, which can easily get like the staph. infection and stuff. And just my word is just based, pay attention to the signs, and when you get accumulated, make sure that a lot of things happen. Like not only you cleaning your areas and the area that you're setting is clean also, but also your technician or people that handling you are doing the right thing, cleaning their, washing their hands and putting gloves on, prior and before and after, the accumulation and stuff. But with that said, that more or less my story. I stayed on dialysis for 7 years. I'm a transplant patient, and I got my transplant in 2017, and 8 years, and I'm doing great.
Thank you so much, Johnny. You shared some tips. I kind of had to laugh and chuckle because I'm kind of the Clorox wipe girl too. So anyway, so thank you so much for sharing that.
Thank you.
Yeah, really appreciate that. I think that these are so important to actually hear it from other patients and what they've actually experienced and, kind of how they try to keep themselves safe. So I really appreciate that. So I'd love to now introduce Timmy Nelson, and Timmy's going to tell you kind of a little bit more about his story. So I'll let you take it away there, Timmy.
Thanks, Mary. Appreciate it. And my thanks to you, Mary, to Dr. Landry, to my partner, Johnny. Johnny, I discovered something just now. You and I were transplanted the same year.
Yeah.
In fact, my transplant day was yesterday.
Oh, wow.
So
Hey,
8 years for me also. So
yeah.
so we're partners in transplant in more than one way. So
Yeah, we are.
all right. My name is Timmy Nelson, and I was diagnosed in January of 2013. Purely accidental. I was in for some other procedures and they did some tests, and I learned what the word creatinine meant before I left the hospital. In April that year, I had my first nephrologist visit, and I was diagnosed at stage 3. And by December of 2013, I was on dialysis. And I chose my modality as peritoneal dialysis. As I mentioned, yesterday was my transplant year for date, and it's been 8 years for me also. First, PD. I've talked to some patients, and some patients have been very frank with me and says, no, but that the work involved with PD, the risk of getting an infection, I don't know if I want to go that route. And I'm not here to convince you to go PD, but to share with you how I went 3.5 years on PD and never had an infection. And I'll share that story with you. Now, I chose PD because as I examined the paths for dialysis, in my mind, PD was best for me for a couple of reasons. First of all, I got the most dialysis I could get. And I was really concerned about how can I keep my system as clean as possible? What do I need to do that? Now, my personality, I'm very, very independent. And so PD worked for me because it was stressed to me that this is totally your responsibility. No matter every day, day in, day out, my 9-hour sessions, me connecting each day, disconnecting, it's totally up to me to do this. And I'll admit that may not be for everyone, but it's something I would encourage everyone to think about if that time comes to do dialysis. The other part about it is that I did, when I was on dialysis, I was still working. And my job required frequent air travel. In fact, to the tune of at least 3 days a week, I'm in a different city. And so for me to try to find a dialysis facility to schedule dialysis, for me, the simplest thing was to say, learn to do PD, take my cycler with me. As I build my schedule every month for my travel, I built my schedule to have my supplies delivered also to hotels. And so that was my life for 3.5 years. Also, in my personal life, I didn't stop doing anything. I took cruises when I was on PD. I traveled with my family when I was on PD, whether it be by car, air, whatever the mode is. So I did not want to change anything in my life structure because my philosophy was I was going to control dialysis. Dialysis was not going to control me. And so that was just my thought process, and that's who Timmy Nelson is. Let me talk about my PD nurse, Jen. In fact, Jen just retired earlier this year, and I give Jen all the credit in the world for me being the staunch PD patient that I was, and for me not getting any infections. We had some long talks about PD, and we talked about what was required of me to do this. And Jen's first comment to me had to do with the risk of infection. And as she trained me, Jen focused time and time again on you must do what I'm training you to do, the way I'm training you to do it, no deviation. If you do that, you are far less likely to contract an infection. And that stuck in my head. In fact, I'll share with you, I developed a healthy fear of an infection. And I say healthy fear because I knew that if I did everything I was supposed to do the way I was trained, I'm very less likely to get an infection. And this is something Jen and I talked about on a regular basis. Every session I went to her, we talked about the process. Now, that process is a routine that's still in my head now after all this time. And it talked about, first of all, zero deviation from my training. It talked about me as I prepared to do my PD. It talked about me gathering my supplies, having them ready and available, everything that I needed to connect or disconnect. It talked about me going into a private area where I could close the ventilation. It talked about me putting a mask on. It talked about, as Johnny just mentioned, it talked about hand washing, the hand washing process. And those things I still follow today as far as the hand washing process because I saw the value in it. So those are the things that I focused on. It talked about the difference between something that's clean and something that's sterile. It talked about the most important thing of all these things. I had to keep in mind, I'm at risk twice during my process, when I'm disconnecting and when I'm connecting. And if I can make sure I do everything I'm supposed to do, as far as disconnecting and connecting, I am far less likely to contract an infection. Now, something that's been mentioned already, and I'll share again, is that I look at infections as two-pronged opportunities, if you would. And the one opportunity is when someone is working with you or treating you and they don't do what they're supposed to do, and that can cause you an infection. In my case, the second prong was me not doing the things I'm supposed to do and causing myself to get an infection. As Jen shared with me, if you've ever had a stomach ache, an infection in your peritoneal cavity is the worst stomach ache you're ever going to get. And her comment to me was, she said, if you ever get an infection in your peritoneal cavity, you'll make sure you don't do it again. My goal was to not do that. And so again, to me, it wasn't anything magical. It was, I developed this healthy fear of getting an infection. And I say healthy fear, a fear that kept me focused on doing the things I'm supposed to do. I became almost robotic as far as my process. And I'm very confident after 8 years even, I could probably go through that process again as I think about it, because it was etched in my brain and I was robotic. Here are the things that I'm supposed to do. So in PD infections, again, can happen primarily when you're disconnecting and when you're connecting, because that's when that catheter is open to the air, if you would, into whatever can get inside that catheter. So that was my focal point, connecting and disconnecting, following the procedures, not sidestepping anything, doing exactly as I was trained. And again, I'll share with you, I created this healthy fear of getting an infection. And that's why I went 3.5 years without getting an infection, doing peritoneal 9 hours a day, every day, on cruise ships, in hotels, and wherever I may be. I made sure I followed that procedure every step of the way. Back to you, Mary.
Timmy, again, wonderful tips. I think how you mentioned about the healthy fear. I think that's really a really good way to look at it. And I think the other is, how you talked about being robotic. I think when we kind of ingrain things into our brain, we just kind of become that robotic. And that can be so helpful when we're trying to avoid an infection. So again, I really thank you for that. And unfortunately, our next speaker is unable to make it tonight, but the good part is that she has some valuable information, and we have some slides that we have from her. So with that, I'm going to turn it over to Kelly, since she has those slides, and she'll go over a little bit what Stephanie Dixon would have, if she would have been able to make it on tonight. Unfortunately, she's not. So we're going to actually share her slides on her behalf, and Kelly's going to present those. Because again, I think another, I call it, this is the tips night. And I think it's a great way to really kind of look at how do we keep ourselves safe.
Yes. Thank you, Mary. I do apologize. Stephanie, I have been speaking with her off and on today, and I'm not sure what happened, but she is not here. So fortunately, I do have slides for her. We worked on them together today. So I'm just gonna kind of go through those and tell you a little bit about Stephanie's story and what she would have told you if she was here. Let me switch to slide mode here. So there we go. Okay, so actually, I'm not going to do this in slide mode because I think these slides are advancing on their own, and I don't want to do that. So I'm just going to do them here so everybody can everybody see this okay? Let me make it a little bit bigger.
Yeah.
Okay. This is Stephanie Dixon. She is a member of the Forum's Kidney Patient Advisory Council. She has been a member for many years. And she's also a member of the CDC's Making Dialysis Safer for Patients Coalition. Dr. Landry mentioned this coalition a little while ago in his presentation. She's also a member of the Sepsis Alliance. So she's actually going to be doing some outreach in September about sepsis awareness through the forum. So this is the heart and soul of Stephanie Dixon is infection prevention. Let's see, next slide. There she is, yay!
I had to re-register to be able to get on. The link wasn't working. I tried everything. I'm so sorry.
No, that's all right. We're so glad you're here. I'm gonna let you take it from here. I just am on your third slide, so you are welcome to take it over. I'm so glad you're here.
Okay, give me half a second. Let me get myself together. I'm so sorry. I had
Take your
treatment
time.
today. I apologize to everyone. I fell asleep and turn the light on so I can see and put my glasses on. Oh, I assume we're recording so I can listen back to
Yes.
everything.
Yes.
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 Thanks, Stephanie.
Okay. Thank you. Let's see. Oh, okay, great. Today's goal. My goal today is to impart how I avoid infection, patient safety, the importance of hand washing, and to share the CDC resource, Speak Up. Okay, what happened?
I went to the next slide. You ready?
Yeah, okay. Dialysis experience. Okay. I've been on dialysis for 23 years. My first 4, I was on peritoneal, and the last 19 years, I've been in center, infection free. Next slide. Okay. For ESRD patients, infection is the leading cause of hospitalization or death. In that regard, I understand that most people we can't see germs, but if we could see germs, how would that affect us? I'd appreciate you playing the video, Kelly.
Yeah.
What if bacteria were not invisible? You can see the man is covered now in green slime, which is meant to represent infection or bacteria. The doctor hasn't washed his hands. He's not wearing gloves. He's touching, he's touching the patient barehanded. Doctor didn't wash his hands. You can see he's covered in slime. He goes to the box. He doesn't perform any type of hand hygiene. He's touching surfaces. Bacteria is transferred to the surface. Shakes a random woman's hand, another person, and you can see germs spread very rapidly. Moral of the story, wash your hands. It just makes sense. Thank you. And the next slide.
Oh.
Okay.
Oh, sorry guys. Hold on one sec.
Well, Okay, to avoid infection, it's important that we wash our hands. As a patient, you should make sure before you're being treated that your nurse or your PCT, your personal care technician, they should put on clean gloves before starting your treatment. There are many people who consider the way they wash their hands to be perfect, which is not. This short video demonstrates how one should wash their hands in a clinical setting. Kindly play the video.
Give me one sec here.
How to hand wash with soap and water. Okay, it's suggested that we turn on the water first, wet your hands. Apply soap. It should not be hot water. It should be either warm or cold. You rub your palms together, the backs of your hands, in between your fingers. Curve your fingers and wash your fingernails, the left hand in the right hand into the left. And then your thumbs, and rinse. If your sink has a faucet that you have to turn on and off manually, it's best to use a paper towel to turn the water off. This film is from the World Health Organization. Excuse me. So in order to avoid infection, wash your hands. The CDC recommends that you check your vascular access for signs of infection. Those signs could include redness, which is pus or drainage, swelling. If you have a catheter, you should notify someone at your clinic if you get it wet or dry. Avoid getting it wet at all costs. And you should notify your care team if any of the above symptoms are present. You should also speak up if there's blood on your chair or on the equipment. We've all come into the clinic and at some point or another, you've seen that. That means that the chair was not cleaned properly and there's blood from the previous person. You should speak up if your nurse or PCT has not cleaned their hands or applied clean gloves before starting your treatment. You don't want them touching you when they've been touching someone else. Next
Stephanie,
slide, please.
did you want to mention this video resource that
Oh,
you had?
yes, I'm sorry. Thank you. This video, unfortunately, we don't have time today to watch it, but Kelly is going to put the link up on the screen. Okay, as a member of, one second, as a member of Making Dialysis Safer for Patients Coalition, I strongly suggest that everyone watch the video associated with Speak Up. I know when I first started, I was very uncomfortable. I didn't feel comfortable saying to someone, please wash your hands, please change your gloves. But this video offers patients and staff gentle ways of saying to a person without being rude to please wash their hands. My kids say I'm extra. I go the extra mile, and I have signs by my chair. One says, please wash your hands, and the other one says, stop. Wash your hands before and after patient care, even if you wear gloves. Always change your gloves between patients. Available on Amazon. However, the stop sign, I didn't realize it was a sticker when I purchased it. So I just put it on a piece of cardboard, mounted it, cut it out, and I bring it to the clinic every day. I have a small easel that I put it on. Okay. Next slide, please. When we discuss hand hygiene applies to your doctor, your nurse, your personal care technician, clinical staff, maintenance staff, visitors, ambulette staff, and home attendants. I have seen in some clinics where the maintenance staff receives their supplies, gloves, etc., from the patient care area. They should not, no one should be allowed to come into the patient care area with dirty hands and access the gloves, anything in the patient care area. Proper hand hygiene, there's Purell constantly all around the unit. Anyone, if they want gloves, they should clean their hands at the sink and or use alcohol-based hand sanitizer. Okay. These are my tips. Wash your hands. Watch the Speak Up video. Use alcohol-based sanitizer when water is not available. Use a paper towel when entering or exiting the bathroom. Use a paper towel before or after you wash your hands to turn the sink on or off. And don't forget to speak up. Thank you.
Thank you so much, Stephanie. I can't thank you enough I'm glad you were able to join us and get on, because I knew you had a amazing PowerPoint to present. And I think with all of the folks, I think with Dr. Landry kind of giving us a really overview of the infection rates and how, what happens and what can we do. And then you hear from folks that have been through it, that have had infections. You've heard how people have avoided infections and not gotten them. I mean, and isn't that the goal, is to, avoid avoid infections, avoid hospitalizations. I appreciate you all joining tonight. With that, I don't know if we have any comments in the chat. I have not seen anything. But if people haven't had a chance to do that, if they'd want to just raise their hand, I'm happy to just call on you because we do have a few minutes. And I would love to, and if anybody else has, just a comment, maybe it's a tip on what they do to prevent infection. And I'm seeing, a lot of people have joined, and I'm wonderful to see that. Please, this is being recorded, so I hope that you'll be able to share also with some of your friends and family. So with that, any questions?
I have a question.
Go ahead, Precious.
Yeah, this is Precious. So first of all, great speakers, wonderful presentations. I've learned a lot. Some things I thought I knew that I didn't know about the temperature of the water when washing your hands. Um, I had a question for Stephanie. Now, Stephanie, I know you have lived with a catheter, for a very, very long time to receive your dialysis treatments. Like, could you explain to us, like, how do you keep that from getting infected? Because you have like a 0 infection rate throughout your whole dialysis journey. And I was just curious to know, like, what do you do to keep your catheter clean and from getting infections? How do you care for that catheter? Because as patients, we always hear that, catheter should be the last resort. Try to get away from the catheter because of the high infection rate. So I was just curious to know, like, how do you care for your catheter to prevent infections?
Okay, first off, as I said, I'm very cautious when anyone comes near me in center. And I always ensure, or when I get it, say a new person, I let them know that I am quite particular about not receiving an infection. And I point to my signs and I say to them, I appreciate you're washing your hands, you're changing your gloves, etc. The most common question that I normally get about my catheter is, how do I shower? And I didn't submit the picture to Kelly of my bathtub, but before I got my bench, you've seen shower chairs. I have a shower bench. But before I got it, I would stand up in the shower and I would turn my back to the faucet and allow the water to only hit the back of my body, and then strategically put the rest of my body under the water or use my cloth where I couldn't on my left side where my catheter is. And basically, that's it.
Thank you, Stephanie.
This is Timmy. If I could make a comment about Stephanie, and I have so much respect for what Stephanie says. I met Stephanie back in 2016, maybe, at a CMS meeting. And day one, when I met Stephanie, she talked about infection prevention, hand washing, and she has been consistent. Every time I see her or I'm around her, she speaks about this very same topic. So this is a patient that lives infection prevention, and anyone around her, you're going to learn about infection prevention. And she's a living example of what you need to do to make sure you don't get infections. So Stephanie, thank you. From one patient to the other, thank you for all you're doing.
Thank you, Timmy. Oh, Kelly, I just emailed you a picture of my bathtub with the bench, which I can sit on, and I don't know if you'll be able to pull it up, but I also, my daughter, okay.
I'll try.
As you listen to these stories and the ways of prevention, it just kind of reminds you of how important taking those extra steps, washing your hands, making sure others are washing their hands, all the things that you've heard from Johnny and Timmy and Stephanie what they do to prevent infections. And I think, that's all we can really do. And I think when we look at that, we can try all the things we possibly can. And those reminders when people haven't washed their hands or haven't come near, or you haven't seen them glove. Those are the things that are really important. Precious, by you asking Stephanie, I think that was one of my questions too, is, I was a person that also had a catheter. And I was, I constantly was making sure that it was clean, because I was so afraid, that was my only access. And I think those are the things that when we look at that, is how important that is to take that care. I think, as Stephanie was talking about too, is making sure you're turning your back to the water, that it's not, coming on the catheter itself. Again, a lot of really good points and tips. Dr. Landry, do you have any last things you'd like to comment on?
Yeah, thanks, Mary, and again, thanks everyone for the great information and great conversation. I think just one thing, as I was listening tonight, that I kind of will go back to a little bit, but I think as we talk about certain things, and I showed some data about there being higher infection risks or rates with certain things like hemodialysis catheters, I also mentioned too that it's not necessarily always a foregone conclusion. And I think one important piece that I would take away from all this is what you heard from Stephanie and others, is that the catheter is a choice for her. And when people can make informed decisions and make that choice, guess what? Those are the people who are empowered the most. Those are the people who are involved in their care. And sure enough, the rates of infection drop drastically. So I think that, part of the challenge we still face in this country is they say that some of the most recent data still to this date is that most people when they do start hemodialysis, about 70% of them start with a catheter. And if those 70% of people were people who made an informed decision to say, I want a catheter, I don't think we'd see the infection rates that we see. The challenge is that many of these patients start dialysis kind of as crashing in, and they don't really have the choice. And when you don't have the choice and you don't have that education, you're not informed, and you don't demand that education from others, this is where the risk really lies. So I think no matter what direction you go, what modality you choose, what approach you take for access, the most important thing, as everyone has already said here tonight, is that you really kind of be the captain of your ship, that you be, the person who takes charge of your care and demand nothing less than the best from the people around you.
With that, I think we couldn't have said that better by, saying that you're really your own best advocate. And I totally agree. When you choose a modality, you do have a tendency, to have, where you want to make sure that that's what you want, and that's, that you do better oftentimes by having those choices. Stephanie, were you going to add a point there? I'm sorry, I might have cut you off.
Yeah, that's okay. I was going to add, I also buy my own bandage, the Tegaderm. My clinic doesn't supply it, so I supply bandage because they were just putting a gauze over my opening and tape. And it really bothered my skin, no matter whether they used regular tape, silk tape, whatever. So my previous clinic used to use Tegaderm, so I now buy my own water resistant covering. But again, Kelly, I don't know if you were able to get my email of the tub.
I wasn't. I've been checking my emails and nothing has come through yet. So
Okay.
I'm sorry.
Yeah.
Okay, it's okay.
Well, I know we're just about at time, and I really appreciate everybody jumping on. I know for a lot of you, it's dinner time, and I think this is a very important topic. And I think, hearing really from Johnny and Timmy and Stephanie, and Dr. Landry, you've got a wealth of information. Hopefully you can take some of those tips away with you. So I really want to thank everyone today. In the feed, you'll see in the chat that we have a survey in the chat. Please fill that out and let us know how we did. And we also have another webinar coming up next month and the following month. Next month will be on home dialysis, and the month after that will be on transplant. So please watch for those. They are posted, and we'd love to have you join us for those. And, you know, also, if you can think of things that you'd like to hear more information on, please let us know. We are here for you. Again, we'll send a link after this. You'll get that in an email in case you aren't able to get on the to complete the survey through the chat. But with that, I thank you all for your time, and have a good evening, and have a great day. Good night, everyone.
Good night.
Thank
Thanks,
you.
everyone.
Thank you,
Been
everyone.
great. Good night.
Good night.